A new report from the Arizona Alliance for Adolescent Health looks at the health and well-being of Arizona's youth. The report found, among other things, that many kids don't see doctors regularly. They struggle to read at grade level and often are victims of abuse. For more on the survey and its findings, we welcome Tracy Perdotti, an adolescent health program supervisor with the organization Affirm. Good to see you. Thanks for joining.
Thank you for having me.
What exactly did this report look at and what did it find?
Well, we know that a lot of sources of data may focus on a particular population of young people or a particular health issue, and we wanted to get a more complete picture of what young people were experiencing and how those experiences were contributing to their health outcomes. And so we identified indicators across lots of different systems that young people interact with and present this broad picture of youth health and well-being.
Indeed, it's like physical, emotional, social, economic, environmental. I mean, you covered the waterfront here, huh?
Yes, it was an endeavor.
Yeah, okay. So how do you study something like this with young people?
Well, we're lucky enough to have a lot of reputable sources of data and researchers across the state and the country who actually did the hard work of the data collection. And we convened some stakeholders who are interested in adolescent health and collated all of the hundreds of health indicators and really worked hard to wean them down to create a story that showed us across those physical, emotional, social, economic environments, what are young people experiencing and how is that impacting their health and development?
Let's talk about family and community. What was found there?
Oh, there are so many stats in there that I'm not able to articulate the details, but ultimately we've recognized that young people need safe and nurturing environments. They need to have bonds with caring adults and parents. They need to have communities that are safe, and we're lacking in that area in Arizona.
So there is a problem. Education development in general, what did you find?
Education and workforce development. I mean, we're among the worst in the nation for education, K through 12.
And the workforce development, I would imagine, would also kind of coalesce with economic well-being. There's a little bit of a Venn diagram there, huh?
Right. And that's the point, is we want young people to have thriving learning environments that contribute to long-term success in their careers.
When you talk about workforce development with young people, what exactly are we talking about?
Well, in the report, we're talking about young people who actually aren't connected to school or work in any way, and there are hundreds of thousands of them across the state. And so getting them connected to learning opportunities, whether it be typical high school experiences or other learning opportunities, so that they can build skills to be contributing citizens.
Right. And when we mention environmental and climate concerns, how does that factor into all this?
Well, the data is really difficult to find on how it actually impacts youth, but we know that among the worst in the nation for air pollution, and that certainly has an impact on young people's health. And then we know that there are inequities in who experiences these health indicators.
Right.
So young people who have complex health needs or recently immigrated young people, those are all young people experiencing greater rates of health challenges.
And those health challenges could be met by going to see a doctor, but they're not seeing doctors regularly.
Yeah, that's one angle that we want to point out. And really, the report is intended to uplift the work of the folks that are doing lots of interventions and projects and products that impact young people. Because if we can get a baseline understanding of their health, if we can offer them resources, supports, if they know that the adults in their lives care about their future and the trajectory of their future, then there'll be more success.
And I would imagine that's where mental health concerns come in.
Right. We know the report focused on the years between 2020 and 2022, so we know that COVID had a significant impact on mental health, but also adolescence is just a crucial stage of development when young people are going through tremendous changes physically, emotionally, socially, psychologically, and that's setting a foundation for their future.
I found this fascinating, access to fresh and healthy foods. You looked at that as well, huh?
We tried to bring all of the data together to give a more comprehensive perspective of the story of young people.
Was that a problem? Was that a problem?
Right, that young people don't have access to it in the rates that other young people across the nation do.
So what do we take from all this? I mean, it's just obvious. This is pretty comprehensive stuff here, and there's a lot of delineation might be difficult to find and difficult to grasp. What do we take from this?
Right. So the point of the report is to take those various sources of data across lots of reputable researchers and bring it together to amplify the fact that we are doing a disservice to young people, that they are experiencing some significant negative health outcomes. And we need to be invested in adjusting our environments and dedicating our funds and creating environments that are more youth-friendly and centered on young people, that uplift them, that let them know that adults want them to thrive and be successful, and we know that that's part of our responsibility.
All right, very good. Tracy Pedati again with Affirm. Boy, a lot to go over in that study. Thank you so much for joining.
Thank you, Ted.